Okay, we are going to do an update, actually tell the whole story, but you've had so many additional things. I'm here with Rick today, and he lives in Midlothian, Texas. Rick, give me a little background. What was going on with you? And this was what, about 3 or 4 years ago that you were introduced to this, right?
Yes.
Okay, so what was going on?
Well, first of all, I've got a background where I already knew about stem cells, and when I heard about this product, I was sold. I didn't even see it. I filled my paperwork out and didn't even see a seminar. They made me go back and see a seminar. I was excited, but after COVID, I had so many problems that I was ready for anything, and it's just been a phenomenal success story for me.
Awesome. What was going on?
Well, in bottom line, I came out of COVID with chronic kidney disease, stage 3A.
Wow.
Headed for dialysis. I had heart AFib. I had chronic fatigue. I was just worn out all the time. I just didn't really care. I just sat around and did very little. I didn't have the ambition or
motivation
energy.
was gone.
Yeah, motivation was gone.
Yeah.
So that's what was the impetus that pushed me to get the stem cells.
Okay. You had some other issues going on too.
I did. They go all the way back into the early 50s, allergies, airborne allergies, and bathroom issues where I get up 3, 4, 5 times at night to go to the bathroom. Just lots of things. And then in 2000, roughly, I started with irritable bowel syndrome. Diarrhea.
Not fun. Yeah, not fun.
It was a horrible experience because I never went anywhere that I didn't know where the bathrooms were along the way.
Yeah.
And it gets a little exciting sometimes. And then a few years after that, I was diagnosed with autoimmune disease, myasthenia gravis. It's in the MS category.
Wow.
It's where your nerves don't communicate well with your muscles.
I didn't realize that was part of MS. Okay.
It is.
Okay.
I'm a member of the MS Society now.
Wow. All right. So you received cells when? And the matrix. We're going to call it the matrix. When and you received it?
2nd of June, 2023.
23. Okay. So what did you begin to notice that was happening?
Well, within about 3 days, my energy just went through the roof.
Oh, that's cool.
Yeah, it was awesome. Then I had an occasion to be in the hospital about 6, 7 weeks after I had the cells. And I asked the nurse, I said, did you do an EGFR when you took blood? And she said, I think so. What is it? Well, my EGFR in stage 3A was 43. That means 43% of my kidneys were working.
Wow.
She says, well, it's 59. And I was happy beyond belief, but 60 is the cutoff.
Oh my.
So Sunday morning, I asked what my EGFR was, and she says, it doesn't say here, it just says over 60.
Oh wow, cool.
So, and it's been right in that area ever since.
Oh, that's a wow, yes.
Yeah. Then it's awesome. You know, skin cancers, I still have the keratomas, but nowhere near what I had before. I still see a dermatologist.
Yeah, right.
But I've got a list of things here that have affected me.
Yeah, well, just read them off if you want to.
Yeah.
Just.
I started off with the airborne allergies, getting up, go to the bathroom, deep pockets in the bone between my teeth.
Ooh.
I've had surgery on my lower gums. I've had the best, since I've had these cells, I have had the best physicals, blood work physicals that I've had since my 40s.
Wow, that's awesome.
It
That's
is.
awesome.
It truly is.
How about your irritable bowel? And is that gone?
The irritable bowel is not gone. However, I've been off medication for a year and a half.
Oh, that's
and
wonderful.
Now it's just a minor irritation sometimes.
Which could be just kind of like normal things when happens to everybody occasionally. Yeah, yeah. All right.
Absolutely.
What else?
Well, fever, blisters, and mouth sores. I haven't had any. You take that back. I've had one since I got my cells, and it was within 6 months.
Mm-hmm.
So, and I was having those on a regular basis. Vertigo. I don't believe I've had vertigo since I've had the cells.
So vertigon.
Vertigo. I like that. Short-term memory is improving. COVID was really hard on
Yeah.
me. To this day, there's some words I have trouble pronouncing, especially scientific terms.
Oh my. Fortunately, you don't have to do that every day now. Talk scientifically.
Right.
Yeah. Okay.
I had beginning of carpal tunnel syndrome. When I would use a hammer or something, my wrist would hurt, and that's gone.
Love it.
Foot and leg cramps. I was getting up 5 and 6 times a night after
That's
COVID to walk. And I think I've done that once since I've had cells.
Wow. That's beautiful. That's
It's
good news.
wonderful. Heart AFib, part of my COVID experience.
Yes.
Still have it, but the pacemaker, they told me the battery would probably last about 5 years. 6 months later, they said, well, we think it probably lasts a little over 6 years. 6 months later, they said, well, you're probably good for 7 years, or we don't know.
So in other words, it's not having to work very much anymore.
It's not working real hard.
Yeah, that's awesome.
I love that.
Yeah, that's a good story.
I had a 1-inch cyst right in the middle of my chest. And the dermatologist says, I can take that off, but it'll come back. And so it became infected. He drained it. I haven't seen it since.
Oh, I love it. Yeah.
Yeah.
Cool.
You know, nothing else was done. So
Yeah.
It's got to be the cells.
Yeah.
But three of my favorites. I get a little bit of red hair back. Just a touch.
I can tell because
Just
you
a
were
little
pretty
bit.
white. Yes.
I was totally white.
Yeah.
Redheads don't go gray; they go white.
Yeah. Yeah.
I had a tooth. The dentist said next time I come in, you'd feel it. He's still looking for that cavity.
I love it. Your wife has that same story too, doesn't
She
she?
had two
Yeah.
that way.
Yeah, that's cool.
But one of my favorites lately is prostate blood test, the PSA. Mine, anything below 4 is good, and mine has always been right in the middle, 2.5, 2.6 in that area. It's been good. I was never concerned about that. And last June, my doctor came in with the biggest grin on his face, and he said 0.95.
Whoa.
You know, he repeated that
Yeah.
6 times in about the 4 or 5 minutes I was in with him.
Oh my goodness. He was trying to absorb the reality.
There's probably not a lot of 82-year-old men that have
Yeah.
that low.
Yeah, that's beautiful.
It's
Yeah,
great,
yeah.
and it seems like every 3 or 4 months there's something new.
Yeah, isn't that fun?
You know,
Yeah.
they're not all great biggies. They're not all things that I would have probably had the cells for, but they're great benefits.
Yes, absolutely.
Quality of life is just improved
Yeah,
considerably.
you're getting ready to do a nice road trip.
We are.
Yeah, which you wouldn't have been able to do otherwise, and so that's exciting.
Yeah, just 4 months in the motorhome.
Yeah, just running up to Alaska and back or somewhere, I think you told me.
Alaska.
So, yeah, that's awesome. Well, would you recommend these regenerative cell factors?
I recommend everybody learn about them
Yeah.
at any age, for any reason, just because they can have them in their back pocket if they need them. But
Yeah.
I think everybody should have them, and if they're experiencing medical problems, do it.
Yeah,
Do it.
awesome. Well, I appreciate your update. Oh my gosh. Just keep your little piece of paper and just keep adding on because it's pretty cool.
Well, I added one on 2 weeks ago on the, well, I don't even remember what it was now, but I'm sorry.
That's okay. That's all right.
There's too many to keep
Yeah.
track of.
But that's
That's a
pretty
good
cool.
thing.
Yeah, that's a good thing. Yeah, you got it for one or two reasons, and look at all of the benefits additional that you got.
It has been.
Yeah.
And I know and I personally know so many other people that
Yeah.
are saying the same thing.
Yeah, that's cool. I appreciate your time. Thanks, Rick.
Thank you.